Meningitis in children, 6mo to 6 year. Pathogen, notes Streptococcus pneumoniae, most common cause, Gram diplococci. Neisseria meningitis, Gram-set diplococci, petechial rash, outbreaks. Haemophilus influenzae type B, due to vaccine, affects unvaccinated kids. Group B streptococcus, early infancy, less common in this age group. Enteroviruses, most common viral cause, e.g. echovirus, Coxsackie virus, normal glucose. USMLE style questions 1. Streptococcus pneumonia. Question. A 3-year-old girl presents with fever, irritability, vomiting, and a bulging fontanelle. CSF analysis shows neutrophils, DAC glucose, and protein. Gram stain shows gram-positive lancet-shaped diplococci. Which of the following is the best empiric antibiotic treatment? A. Ampicillin. B. Ceftriaxone plus vancomycin. C. Gentamicin. D. Meropenem. E. Amoxicillin. Correct answer B. Ceftriaxone's vancomycin. Explanation. S. pneumoniae is the most common bacterial meningitis cause in children. Due to increasing penicillin cephalosporin resistance, vancomycin is added. Why not others? A. Ampicillin, not adequate monotherapy for resistant S. pneumoniae. C. Gentamicin, poor CNS penetration. D. Meropenem, reserved for resistant or complicated cases. E. Amoxicillin, not first line for meningitis. On to Neisseria meningitis. Question. A 6-year-old boy presents with fever, headache, photophobia, and a petechial rash. CSF shows gram-negative diplococci. What is the most appropriate initial antibiotic therapy? A. Ceftriaxone. B. Vancomycin. C. Doxycycline. D. TMSMX. E. Azithromycin. Correct answer. A. Ceftriaxone. Explanation. N. meningitis is highly sensitive to third-gen cephalosporins, especially ceftriaxone. Empiric therapy may include vancomycin until sensitivity is confirmed, but ceftriaxone alone is sufficient in many cases once diagnosis is clear. Why not others? B. Vancomycin, not needed alone, used only in combo until cultures return. C. Doxycycline, not for kids 8 years. D. TMPSMX, not first line for N. meningitis. E. Azithromycin, no role here. 3. Haemophilus influenzae type B. Question. A 2-year-old unvaccinated child presents with fever, stiff neck, and altered mental status. CSF shows gram-negative coccobacilli. Which antibiotic is most appropriate? A. Cefotaxime, B. Vancomycin, C. Ampicillin, D. Azithromycin, E. Ciprofloxacin. Correct answer, A. Cefotaxime. Explanation, H. influenza E type B is rare due to Hib vaccine, but still possible in unvaccinated children. Cefotaxime, or ceftriaxone, is first line. Why not others? B. Vancomycin, not needed. H. flu is not resistant like S. pneumo. C. Ampicillin, not reliable due to beta-lactamase production. D. E. Azithromycin and ciprofloxacin, not used for meningitis. 4. Group B streptococcus. Question. A 7-month-old infant, previously hospitalized for neonatal sepsis, returns with fever and lethargy. CSF reveals gram-positive cocci in chains. Which treatment is most appropriate? A. Ceftriaxone. B. Ampicillin's gentamicin. C. Vancomycin. D. Meropenem. E. Linezolid. Correct answer B. Ampicillin's gentamicin. Explanation. Although GBS is more common in neonates, it can persist or recur in infants with prior infection. Ampicillin is effective. Gentamicin adds synergy. Why not others? A. Ceftriaxone doesn't reliably cover listeria or GBS. C. Vancomycin, reserved for resistant gram bacteria. D. E. Meropenem linezolid, not first line for GBS. 5. Enteroviruses. Question. A 4-year-old vaccinated girl presents with fever, headache, and photophobia. CSF shows lymphocytic predominance, normal glucose, and slightly elevated protein. Viral PCR is positive for Coxsackie virus. What is the best next step? A. IV acyclovir. B. Ceftriaxone. C. Dexamethasone. D. Supportive care. E. Oseltamivir. Correct answer D. Explanation. Enteroviruses are the most common viral meningitis cause in children. Treatment is supportive, fluids, antipyretics, rest. Why not others? A. Acyclovir for HSV, not enteroviruses. B. Ceftriaxone, used only if bacterial cause is suspected. C. Dexamethasone, used in H, flu meningitis in select cases, not viral. E. Oseltamivir for influenza, not enteroviruses. Let me know